Can you live your life without having a thyroid gland? This question is asked by one of the patient when that person had to undergo a surgery. And that question was very obvious that doctor, after the surgery, will I be able to survive? So I thought, why not to clarify this point and create a video. So that's where we are today, discussing about can we live our life without having a thyroid gland. Namaste. My name is Dr. Tanvi Mayur Patel. I'm an endocrinologist practicing in Mumbai, India. On a daily basis, I come across so many thyroid patients with the different health concerns. Some of them can be managed with the medications and some of them needs surgery. And when a surgery is indicated, it becomes a very important question. What will be my life without this thyroid gland? So let's find out. Let's understand the thyroid gland, which is located in our neck area. It's a small butterfly-shaped gland which secretes very important hormone, T3 hormone and a T4 hormone. But along with these two hormones, it also secretes one more important hormone called as calcitonin, which helps in regularizing calcium level in the body. So when you have to undergo a surgery for the thyroid gland, all of these hormone productions is going to be hampered, and that is going to impact the later life of yours. Okay. So very common question, why will you not have a thyroid gland? Well, there can be two reasons behind it. The first condition, wherein you are not born with the thyroid gland, or the thyroid gland which is there in your body is not formed correctly, and that we call it as a congenital malformation. Either you are born without the gland or the gland is there but it is malformed. In both the scenario, of course, these are the children who are having a congenital hypothyroidism because they don't have the gland. So of course they don't have all the thyroid hormones. And for them to live a life, they will need to be on a thyroid hormone replacements lifelong. Of course, if their thyroid hormone is not optimized, then their development, their mental development, their physical development, their sexual development, and their IQ, all of that will be compromised. So that is the reason why when a child who does not have a thyroid gland, we have to treat them in a very different way. Okay, so that is the first condition wherein you don't have a thyroid gland. All right. Now let's come to the second scenario. In adults, okay, they have a thyroid gland, but because of some thyroid problem, maybe it could be a thyroid nodule, maybe there can be a goiter, or maybe a thyroid cancer, or for any reason wherein a surgery is indicated and that person has to undergo a surgery, what we call it as a thyroidectomy. Okay, so when a person undergoes a thyroid surgery, that is a scenario, and that is a very common scenario what we come across. The life will be after the thyroid gland. Okay, so in this kind of a surgery, maybe a part or maybe the entire thyroid gland may be removed based on your individual medical case. So we have a total thyroidectomy and we also have a partial or subtotal thyroidectomy. So these are the two kind of surgeries which are usually done in such scenarios. So after the surgery, what happens? So after the surgery, depends on what extent of the thyroid gland was removed. The presence of the thyroid hormone inside your body will vary. Either will be absolutely zero or it will be suboptimal. In both this kind of a situation, it is very important for you to regularize your thyroid hormone. Understand that thyroid hormone, like any other hormone of the body, is needs to be stabilized in a right quantity. Okay, you need a certain amount of the thyroid hormone and you want exactly that much amount, the quantity of the hormone. You don't want more or you don't want less of it, because both the situations can give you hyper or hypothyroidism. So it becomes very important that you regularize and stabilize your thyroid hormone. And if you are not going to optimize that, you are not going to have a very good quality of life. See, when this question is asked, Doctor, will I survive after thyroid gland removal? A pretty much short and simple answer is yes. But are we just talking about the life expectancy, or we are also talking about the quality of life? Quality of life also matters. You don't want to live a life with a lot of body issues, isn't it? So you want a better quality of life. So survival after thyroid gland is very much possible, but having a perfectly good physical, mental and all other kind of a well-being life is very important. And for that, it is very important for you to stabilize your thyroid hormone after the surgery. Because if you don't do that, your body is going to get lot of symptoms of a hypothyroidism, which can range from anywhere from a memory loss to forgetfulness to hair fall to fatigue to not having a regular monthly cycles in women to plenty many other issues. Okay, and I'm sure you don't want to live your life with this kind of a symptoms which is going on for a long time, and that is the reason why it becomes important for you to stabilize and regularize your thyroid hormone. Not only that, if you have undergone a surgery, possibly your calcium level in your body might also be disturbed, so you need to stabilize and regularize that also. So quality of life is important, otherwise you will be landing up into hypothyroidism symptoms. And plenty many times what we have seen that sometimes patients think that once the surgery is done, their job is done, their whatever issue in their body they had, that's sorted out, and now I don't need to follow back with the doctor. We have seen such people doing such innocent mistakes. Please don't do that, because if you try to do that, there might be possibility that your hypothyroidism can become more and more severe. And if you don't correct this kind of a hypothyroidism when it is a mild to moderately disturbed, it can progress to the severe hypothyroidism. And in that kind of a situation, your body can also undergo into a very life-threatening complication called as a myxedema coma. Yes, you heard it right. This is a life-threatening complication. Don't worry, it's not very common. It's relatively kind of a rare or uncommon, I will say. Happens especially when you have an uncontrolled and a severe hypothyroidism, which is usually precipitated by any kind of a physical or a mental trauma, maybe an infection or maybe an accident that can precipitate this myxedema coma to a much larger extent. Okay, but again, this can happen only if your thyroid is not controlled on time. Okay, plenty many times we have also seen that people may not have all the symptoms of the hypothyroidism and they might just ignore it, or if they have not done any blood test, it will not come into the picture. Okay, so don't make such mistake. If you know that you have undergone a thyroid gland operation, or if you have a malformed thyroid gland from your childhood, you need to be in a regular contact with your thyroid specialist doctor and make sure that all your hormones are optimized correctly so that you live a very healthy life. All right, so that's for today. To know the question, will you survive after thyroid gland or surgery, or can you have life without thyroid gland? All right, I hope after watching this video you got some good and useful information. If yes, please click on the like button. If you are new to my channel, please don't forget to subscribe so that you get more and more health related information, especially hormone related information. And if you have any of your personal question whose answer you are seeking for, then write that in the comment box below. I try to read and answer them as early as I can. Alright, we will meet again in another video with some more good useful information. Till then, take care of yourself. Namaste.